Okay, good afternoon. For all of you who are online, we are back in the lecture room after our breakouts. Our timing is a little bit adjusted, but I've been assured everything is going to be okay. My name is Lori Melliker. I work at the Robert Wood Johnson Foundation. This is a national foundation that is working to dismantle structural racism and other barriers to health. For the past, I've been there for 23 years. For the past 12 years, I've led a team at the foundation, which is within our Department of Research, Evaluation, and Learning, called Pioneering Ideas for an Equitable Future. This group is charged with anticipating the future for the foundation. So we work to identify signals of change. We try to understand whether these signals indicate a trend, how that trend may impact health equity in the future. And then we work with others to try to influence the impact of these trends. And we're trying to work towards a more equitable future. And we have a particular focus on trying to transform the health science and knowledge system. So you can see why the work of this committee was a perfect fit for the work of my team within the foundation. And we are so pleased to have co-funded this amazing report. So if you haven't read this full report, you really should. You heard from Keith and Deborah about how useful this report is, which I would second and third. You've seen the charts and the images and the tools on the slides today, but I really want to encourage you to read it. This report is so interesting, and it's really well written. It looks back to the past, to history, to try to derive practical guidance towards a more equitable future. And so I just want to commend all the committee members, the advisors, and especially the Academy staff who contributed to the text. So the recommendations and the imperatives are important innovations in and of themselves, offering a framework that will not become outdated as the world changes, and emphasizing continuous reflection and adjustment as rapid change becomes the new normal. This report makes it inexcusable for funders, researchers, companies, and policymakers to not take responsibility for their role in shaping the future. I don't know what to do is no longer an excuse not to take responsibility for determining and mitigating inequities, aligning incentives, and sharpening oversight to support equitable innovation. Read this book. It will tell you what to do. Thank you all who are in the room, and also the many of you online for taking time to participate in this workshop so that together we can move from guidance and recommendations to action and implementation, helping us practice, or to use a word that's more popular with the futurists that I hang out with, praxis, applying equity principles in technology development and innovation to create a culture of ethical, equitable innovation. So I was pleased to join participants in the weight loss drug group and to see them grappling with uncertainty, asking questions like, what's the effect of systemic differences in stigma related to medication use by population on effective access? What are the ethics associated with offering individuals medication to address health disparities caused by environmental conditions that affect communities? Will the availability of drugs to more historically disadvantaged populations shift interest and resources away from underlying causes? Should the prevalence and growth in prevalence prioritize access to medication that address some conditions over other conditions? And what are we going to do about the fact that we don't all agree on the equitable principles? So it's the grappling that we really need to get good at. We just don't know how the world and our control over our work will change as the combinatorial advancement of megatrends, AI, synthetic biology, and the Internet of Things together produce new ways of doing, being, thinking, and seeing. But that is not a good excuse for checking out because we think the challenge is too big, too hard, or too uncertain. So I was trained as an economist, and I came to the Department of Research and Evaluation at RWJ in this capacity. But a few months ago, I changed my LinkedIn profile from economist to futurist because, as I said, that's the work that I've been doing over the past 12 years. And so I would encourage all of you to adopt a futurist mentality in this session as you try to understand your role and responsibility in shaping the future. Think about how you will make decisions in the future that looks very different from what it does today, where incentives are different, and where what is hard today is easier, and what is easy today is harder. How will you continually orient towards health equity in your spheres of influence? In the words of Afrofuturist Lonnie Brooks, how will you create alternative memories of the future? What will be the case studies that will be included in the 10th episode or issue of this report? So the first futurist I'm going to have reflect on these challenges is Dr. George Daly, Dean of the Harvard Medical School and the Caroline Shields Walker Professor of Medicine. Dr. Daly is a physician scientist and an authority on stem cell science and cancer biology. His discoveries have been twice cited in Science Magazine's top 10 breakthroughs for the year, and he's co-authored international guidelines for the conduct and clinical translation of stem cell research and regenerative medicine, and for ethical oversight of emerging biotechnologies. George was the co-chair of the NAM Committee on Emerging Technologies, which proposed the consensus study and was pivotal in helping the National Academy of Medicine develop its earliest efforts in this area. Over to you, George.
Thank you, Lori. I've actually learned that the only archetypes that I fear more than economists are futurists. Because if you remember, Yogi Berra warned us that it's hard to make predictions, especially about the future. So I'm here to really recount some of the history, but also to give some of my thoughts about these two case studies. So first, I want to thank the National Academy for including me. I'm sorry I can't be there in person. I'm here in New York City with my wife, who's being honored by Columbia University tonight, and I just couldn't figure out a way to be able to be in both places at once. So I'm pleased to be able to be here by Zoom. So I've been involved in efforts at responsible governance of science and new technologies for a number of years, especially stem cells and CRISPR gene editing. So this topic is very, very close to my professional passions. And I have to say that serving as the co-chair of the CESTI committee alongside Alondra Nelson and then later Al Picharro, as well as Atul Butte, was really one of the foremost privileges of all of those efforts. I would argue that perhaps more than anything, perhaps other than pandemic preparedness, I can't think of a more urgent policy concern than the need to create guidelines around the ethical and equitable deployment of emerging science, technologies, and innovation. They can't be overstated. To be future-oriented in the way that Lori is talking about, these novel developments have to be nurtured. They have to be nurtured within their social context. They have to be nurtured within the embrace of ethics. And we're really here to take on the challenge of the consensus study for the considerations of equity. I sort of think of innovations like toddlers, if you will. We have to nurture them, we have to support them, and ultimately we hope to raise them into adulthood and responsible citizenship. Now, innovations in their early days, like our children, are a bit unruly. They're a bit temperamental. But adult innovations, ones that have stood the test of time and been absorbed into a social context, they can become mature, they can become functional, and ideally be equitably integrated into society. Now, of course, that's not to say that all adults are mature, as evidenced by the behavior of some of our recent political leaders. But I think we want to approach these issues of the governance of new innovation with an eye towards caretaking and stewardship. So I just want to recount my own sense of the important principles that I think are readily applied to these new technologies, and perhaps these principles in part will be discussed as we recount these case studies. I feel strongly, and our CESTI committee came out with the notion that Governance should be anticipatory rather than reactive. It should engage the public and try to achieve the assent of public. That is, there's a responsibility to socialize new technologies before they're widely disseminated. The technologies have to be subject to peer review. Transparency, therefore, is crucial. The transparency around issues of personal autonomy as well as informed consent. The conflicts of interest of those involved must be evaluated and be transparent. The deliberative process, ideally, of these new technologies, and I know in the concept of both the GLP-1 agonists and the applications of AI to drug development have international ramifications, because we know that much of the benefit accrues to the United States, perhaps Europe, and yet much of the need is distributed more globally. And then I think we'll end up spending a tremendous amount of time thinking about risk-benefit. And we also always understand that the risks of new technology are fundamentally unknown, unquantifiable. But new technologies have always presented unquantifiable risks. And as we know from Daniel Kahneman, the behavioral economist, we do tend to overweight risk. And the problem with that is that it can deprive humanity of much great advantage. And if we had overweighted the risks of recombinant DNA or the risks of CRISPR technologies, we would have deprived the globe of very, very serious advances. So the consensus study then took us further, and it essentially said that we have to prioritize equity. And we know that there's always a challenge, that equity can't be seen as hindering innovation, or else it would potentially fail in the marketplace. And so that puts an emphasis on how we think about ensuring equity, either through regulation or by incentivizing in the marketplace strategies that prioritize equity. Funders can do that by prioritizing the funding of new technology development that is fundamentally equitable. So I just make a few comments about the case studies. I participated in the one in AI in drug development. I did not participate in the one on GLP-1 agonists, but we all appreciate, and as a physician, we know that the challenge of obesity rising rapidly is an enormous threat to global health, as well as global the financing of global healthcare systems. And we already know that these GLP-1 agonists are remarkable at enhancing human health, especially in patients with diabetes and cardiovascular predispositions. But we know that these drugs are extraordinarily expensive. They're already in short supply, and it will get worse. The equitable distribution will get even worse if cosmetic use ends up diverting drugs from those with more approved medical indications. I've been spending a tremendous amount of time recently thinking about the applications of AI across all of medicine, medical education, medical research, clinical care. We had a phenomenal presentation from Linda Stewart from the University of Washington Institute of Protein Design about the amazing power of these new AI models, AlphaFold, RosettaFold. These are transformational technologies. I mean, I have to say, hearing Linda's presentation about what's happening in her center, it truly left me breathless. We are able now to imagine anticipating the development of antibodies, vaccines against emerging pathogens, perhaps pathogens that we haven't ever seen before, but certainly can respond much more quickly to pathogens as they arise. This is going to provide enormous medical benefit. We didn't talk about small molecules, but there's tremendous excitement about AI strategies shortening the timeline for development of small molecules, therefore reducing the cost, enhancing and accelerating the pace of regulatory review of new medicine. So there's enormous benefit, but we have to also acknowledge the risks that are unquantifiable but very real. in the sense of AI applied to protein design or even drug development. We realize there are dual use. There are purposes that could be misapplied. There could be the development of biowarfare or pathogens that would be frightening for the world to behold. AI is also a recipe for exacerbating equity issues. AI is already remarkably concentrated in a few technology companies that have the scale and the resources to command the compute power, and that will only get worse if not approached. I have to say that often the case, and I don't mean to be a techno-optimist, but often the case, technology is the solution to the challenges posed by new technologies. And especially in the applications of AI, we already see a rising tide of interest in making algorithms more efficient, less gobbling up of energy. And so our hope is always to see these advances, again, through the lens of optimizing benefits, minimizing risk, and of course, making it as equitable as possible. So I look forward to the reviews of the case studies, and then I'll come back with some finishing comments. Back to you, Lori. Thank you.
Thank you, George. We're going to come back to you at the end, but next we're going to hear from the moderators in the two breakout groups, Deborah and Tim. Were folks as optimistic in your breakout groups that technology will solve our technology's problems?
Deborah's laugh just worried me on the yes. Yeah, I was just echoing what George did a great job of giving a recap. We did end up in a cautious note of optimism. We did have some realism discussion about things because, again, that's just being reminded of Rob Califf's note that we're 34th, and we're the richest nation in the world, but 34th in health outcomes. That's not. And on our way and dropping like a rock in the pond or something. So that's not an acceptable thing. We all agree with that. The question is, though, how might we do things? And that's one of the things I think in the cautious optimism was using the framework and identifying those things, being foresight-oriented, not being using it to regulate or beat people over the head and say you can't explore your research or try to tell business how it needs to do its job in every possible way, but really to say, look, this is at the end of the day about alignment of incentives to try and get things in place to be able to do that. And there are some just on AI drug discovery, as George mentioned, Linda Stewart did a fantastic job talking about a lot of the discovery in silico type thing. There's a whole process of just then developing those things that actually works and testing it out and doing in silico as well as in vivo, in vitro type things that we normally do. So there's a lot that still could be done. And George mentioned obesity. Again, the GLP-1 thing is here. We have massive expenditures coming for already and coming more with Alzheimer's and so on and other dread diseases. So the time is now to start doing things, however imperfectly, to identify those iteratively through the life cycle and I think learn and organize together, but getting those incentives aligned so that we can bring about that cautious optimism that our group ended on. So thank you, Lori, for, by the way, I meant to say at the top, for your support for the group and for your leading this particular discussion as well.
Before you go, Deborah, I want to make sure that folks in the room know that I am coming to you next. We're going to have a little bit, we're running a little bit behind time, but you guys got back from your break late, so we're going to keep you a little bit later. But there will be time for you to share some of the breakouts, some of your takeaways from the breakouts, your ahas, your hunches, your ideas. Deborah.
So yeah, I'm afraid a little less optimism from the GLP-1 agonists for weight loss group. So we were talking about, of course, an incredibly stigmatized condition that is unequally distributed across people, and that the disease-promoting environments are also unequally distributed. And it's an intensely sort of biological and environmental problem. It's not one thing. So we spent time identifying the challenges, of which there are many, right? Some of which I just mentioned. I also learned a ton from this breakout group because it's not my area of focus. historically there's been an unequal distribution of access to treatments for obesity, and that remains to be the case. And in fact, one of the challenges is that there isn't insurance coverage or government payer coverage for obesity treatments, which is one part of the problem. Also, inequities in who is being enrolled in trials versus where the biggest burden of disease is. The lack of access to the trials for pregnant women when there's a deep relationship between obesity and fertility. Inequities in I think I already mentioned enrollment in clinical trials. We did get a nice additional case study, which was Hep C drug coverage, which was good for us to think about. But when I asked folks, given all of the challenges, okay, where are the levers? Like, where can we actually, given that we see the red on the heat map, what can we do to bring the red closer to orange, yellow, or maybe even move into blue and green? And the answers were across the sectors, I'm happy to report. So FDA and work on pharmacokinetics. Of course, the coverage issue was a big one. We had a conversation around racialized diseases and the need to challenge that framework for thinking about many diseases. And when I asked, okay, so how do we move this forward, because this wasn't a super happy, fun conversation. But if we want to actually, given the conversation, move forward, what's the community that we could really work with to get down to brass tacks, perhaps with an equity playbook? And we got a range of answers. So providers, working with providers on communication with these patients. Primary care providers have challenges and have a lot of bias around it. Payers, right? The payer issue is huge. Pharma patient assistance programs. And then attacking really one of the environmental causes of the disease, which is the food sector. So we got a whole array. It's really a multifaceted answer to how can we shift the conversation in this particular technology and maybe make some change on, or redirect a little bit the way the technology is going.
And just a quick follow-up, because we had public-private partnership come up in that. I just didn't know if that was there as well. This was all part of, because in the AI and drug discovery, it's like you have to have big compute there, and that's automatically a potential barrier, although the new GPT-like technologies and stuff give you tremendous access to, if you can afford the compute power, then you have, from an algorithmic perspective, you have those things. And you have to have, I think, just pointing back to Keith Waylu's remarks earlier, just about all the elements of equity, like equity of the data, equity in the data, equitable use of the data, representation, those sort of things. And I think that's, but it is, at the end of the day, for AI, it is if, not how. And I'll just close by saying, I think, just echoing what Bill Foster said, right? Don't kill the golden goose, but you have to also think small budget, which means, and I coming from my prior life at GAO, which is congressional oversight of expenditures and so on, I'll tell you, that is not theoretical, that is the future. So it's the whole environment I had to live, moving from one position to, when I came to GAO, it was like, I don't have money, so now we have to think. And that's, I think, part of what we can do together to try and do that with small resources. Thank you.
Great. All right, so I'll turn it over to folks in the room and also online. If there was something that you heard or you thought during your breakout group that you didn't hear represented in the report backs, please share that now. But if you thought of something else, something in this room or afterwards that you'd like to share. I see Keith and then someone in the back.
Yeah, I just want to echo one other reason why I found Linda Stewart's presentation from the Institute on protein design so illuminating, and that's because they have been thinking hard about principles on the responsible use of the designs that they are producing, that it's being produced through these new kind of AI protein development mechanisms. And she listed them that I think they're really important to illuminate, which is the development of community guidelines for AI researchers, which has now been published and signed by 200 researchers in the field, which is a version of the playbook. And sharing that would be really, I think, instructive. So that's coming from within the protein design community. The second was coordinating with DNA synthesis, those who involve DNA synthesis on security protocols, like thinking about security uses and misuses. And the last comment I couldn't quite follow, but I'd love to hear more from her or learn more from her about steps to try to ensure that the benefits, right, and countermeasures that are necessary for making sure that what's prioritized is the benefits. So I feel like there are responsible innovators that have been thinking, and not just thinking, but actually implementing and getting other designers to sign on to these kinds of commitments to equity, mitigating risks, and trying at least to ensure that the benefits actually are manifest. And I think one of the maybe steps ahead is to just make sure that that conversation is expanded. The other thing that she talked about was that the Institute for Protein Design is committed to open access, to specifically push back against this idea that there should be only a few organizations that commandeer, the data, that then we are beholden to those organizations to determine how that information is used. So lots of lessons there learned that I think are really useful to build upon.
Great. Okay, the person with the silver computer back there.
Hi, I'm Eric Rubin from the New England Journal of Medicine. We've heard a lot about AI is such an interesting case because although Linda's is from an academic institution, a lot of the development occurred in industry, and in an industry where they really were thinking about the guidelines that they wanted to follow, or at least many of the developers were, and trying to set restrictions around using meta prompts to decide what could be done. I'm really curious what kind of levers, though, we have in industry. An industry, as Keith just said, that wanted to be that had a very interest in being self-policing, but we don't have the sort of access to it that we do to the academic community.
So that sounds like a question either to you or to the room.
I think maybe George, since he knows this field a bit.
George, did you want to try to answer that question?
You don't want to answer, do you, George?
Can you rephrase it, Eric? You were talking about both industry incentives and academic.
Yeah, I'm actually thinking more about the industry side, though.
Yeah.
What kind of incentives can we provide industry so that they will follow these, especially in a field like AI where they already have some inclination to be self-policing?
Yeah, boy, I think that's a tough one. What I have seen so far, and I just returned from the Bay Area where we visited Google, DeepMind, and Microsoft Health, and I found them surprisingly open to fundamental curiosity-driven discovery. I think they see themselves almost in the light of the way Bell Labs grew up around AT&T, that it was open-ended, almost academic in-industry effort that led to, Nobel Prizes and dramatic advancements in communications technology. And they sort of assumed that it would, in the long run, benefit their bottom line. I mean, we asked questions of the leadership of Google. We were led there by Eric Schmidt. How are investments in the development of AlphaFold and all of those applications going to improve Google search or go to the bottom line of their business model? And they said, right now, it doesn't matter. So I think to some extent, these big tech companies right now are incentivized by the power of innovation. That innovation is, in and of itself, a worthy goal. I also think, though, that we have to have partnerships, academic and commercial partnerships. This is, I think, one way of incentivizing. Unless and until Google starts giving PhDs they've got to partner with us to train the workforce of the future. So we're entering some of our conversations about industry partnerships through the lens of what we can uniquely offer, and that is their pipeline of future, future workers in their industry.
I'd like to follow up on Eric's point and also make another one. As you know, in our CESTI, we actually involved a lot of private sector investors as well. And of course, we did hear from some of them who came from previously White House and public sector say, at the end, we have to make money, right? So it becomes a really important issue about incentive. My point in hearing the AI meeting was that increasingly the data, which was from public database, is shifting more and more towards the private, because they're going to have amass a lot more data than ever, and will they make it public to everybody? So the point I'm trying to make, George, is I think when you talk about public-private partnership, it's wonderful when a company talks to you about opportunity with Harvard Medical School, but I think we need to design some principles of public-private partnership. That, to me, to date, doesn't exist, right? What are the fundamental principles? Like you do talk about the data community and others, about what are the kind of general code of conduct, Bill of Rights. I think that ought to be discussed very clearly. So to me, that's a really, really important issue in my mind. Right. The other one, I think that Alondra mentioned in briefing is Mariana Mazzucato's work. Her argument is that if you look at the historical model, Vannevar Bush, the work comes from the public sector, and then it gets licensed to a private sector, and then, of course, commercialized, and this is why our country is so innovative. But there's no conditionality to this. So we're putting billions of dollars into creating innovative opportunities for companies and others, which is great. But what, in fact, do the public get back in return, right? To me, it's a matter of getting down to conditionality. Why can't we talk about pricing the drugs right? Can we talk about some more investment in research based on the output of all these amazing innovations? So I think these are things, to me, that hasn't quite been discussed in this meeting.
Can I respond quickly to no?
Can I let one more question in the room, and then I'll let you all, anyone on this group that wants to finish up? Great.
All right, this is actually just a follow-up also to Eric's question and the answers, is this notion of how to tap into the intention and actually enthusiasm from private sectors and academic innovators to do social good. And one of the things also related to the data question of all these public data being available is the question of appropriate benchmarks, and that actually is perhaps one of the roles that journals like New England Journal of Medicine and others can play, is to set up appropriate benchmarks to encourage alignment with these societal concerns. And so, for example, NeurIPS has a track now on data sets and benchmarks that has become increasingly popular within the tech space. So similarly, perhaps journals like New England Journal of Medicine and others could have a track on data sets and benchmarks as one way of encouraging the community around setting up standards and rules that they can gather around.
Thank you. All right, so we're going to maybe just go down the row if there's anything you want to be sure to say before we leave this session.
Yeah, thanks. I just wanted to respond to something that both George and Victor said about public-private partnership and sort of extend something that you said, Victor, about conditionality, right? I think there's a moment, particularly with AI, and I wasn't in that group, but it's a space that I work in, right? I work at Hopkins. We have lots of patient data. There are companies that would very much like access to those data, right? There's an opportunity there both for public-private partnership and for conditionality, right? Yes, use our data. What's the value that's going to come back to our patient population, right? And thinking not just about, sending the data out, but what are we going to get back that's going to return value to the system in exchange for access to the data?
If I may, we're going to hear later on from Susan Monarez from ARPA-H. You mentioned that earlier today. They are looking at conditionality when you put in a lot of dollars into these big ideas. I do think this is a necessary direction we should be thinking about in terms of how do you subscribe to public good, how do you enable commercialization and incentive in markets, and how do you get some back for the population? So to me, that includes the price of what we pay for the products that are being produced.
Yeah, so I'll close with saying I really like Alondra's slide earlier, just talking about the iPhone was not all just invented in Cupertino, and it leveraged research across, but no one could see the pieces of those sort of things. Apple did have something in there. So really now that I'm in private sector, where before in public sector, the imperative was to spend all your energy spending your money. Now in private sector is making sure you maintain a reserve and are able to survive the next quarter to keep your money. So again, a different system entirely, but I'll just say that markets want two things fundamentally. One is access. Either you're creating the market or you have access to it. And the second is you want certainty. And that just means in the form of ROI and so on. And so if we can find those things, it's a win for the business, maybe through this public-private partnership idea, and yet still be able to achieve all the things that we want from an equity perspective. I think that's where we're cooking with gas, as they say, using our framework. So thank you.
Thank you. George, final words?
Yeah, let me just say, I think these discussions are incredibly compelling. I think it is a conundrum about how we can incentivize innovation in an equitable manner. I hear frequently from my colleagues in biopharma that price controls will stifle innovation, that efforts at equity will hinder innovation. And I have to say, I'm skeptical about that skepticism. I think we have to move forward asking questions, seeking evidence. How much free market is essential before innovation starts to be compromised? We can assess that. There's obviously a tipping point. How do we best use a combination of rational regulation? And I'm glad that we had Representative Foster here and Bob Califf and others. But we've got to use some degree of regulation, as well as identify efforts to incentivize, using market forces, to incentivize industry to optimize equity when they're deploying these new technologies. So I'm hopeful, I really do hope we can advance the cause of equity. It's an ethical imperative, but we're going to do it by conversations like this. And we need these kinds of nuanced conversations, and I really appreciate, and I have to applaud Victor, who, brought up this issue years ago, and he's been like a dog at a bone, and he keeps pushing it, and it's essential. The new technologies continue to emerge. It's like unanticipated emergent behavior, and it's not going to stop. It's going to continue at an extraordinary pace, and these conversations are going to anchor them in our social context. So thanks for an invigorating session, and thanks for including me.
Thank you. And so now that you are all deputized as futurists, I want to remind you that futurists never predict the future. Futurists anticipate probable, plausible, and possible futures. So there are about 1,000 different futures in this room that are in your heads. So I want you to think them through and pick out those that are equitable, and then help you and your colleagues and all of us in the room make decisions that could lead us to at least 1,000 equitable futures that are possible. Thank you.